Okay, so like I've told earlier that it happened, then cross diagnosis or 3D diagnosis required now for that case, which was diagnosed as a fractured tooth post obturation. Of course, the tooth survived for 10 years, but still then it had hurt the patient. The patient came to us with a set of X-rays and some files. We extracted the DICOM files; those are required for it. And then what we did, we went for a understanding of the case at the level of volume rendering and understanding it for the level of fractures if present. Now I'll be showing it there. So guys, welcome to this. So we're in an era of open AI, era of open softwares, era of digital dentistry. Let's take use of it, learn from it, take the autonomy and for this. Okay. So now I'll show you that about the volume rendering. Okay, fine. You can see the beautiful volume rendering in the form of a tooth. Okay. Now if I go down to the level of bone, yup, it is currently covered. But let me clarify that this is the bone. I mean, you can see the anatomy, beautiful anatomy. You can see it from here. Yes, a 3D picture. You can see the anatomy in this level, the sinus and the tooth. So you can see the macular sinus here, for out of the body of the sinus, and then the nasal cavity, the skull parts and all. Yes, if you see here, the patient was complaining that there is a fracture. I mean, the doctor consulted earlier told that there was a fracture in this rooted tooth. So we took a volume rendering in the level of X-ray, and there are many things to be shown here, but let us understand this is a treated tooth because it doesn't resemble natural anatomy, that is a cingulum. You can see the anatomy here, they are very much carved out, but here this is not present. So I'll come to the tooth level, that is I'll minus and segment the bone. Okay, you can see that gradually I have segmented the bone, and then see now you can see the tooth. Okay, so what are the tooth comprised of? The tooth is made up of root and the crown, which is being shown here. You can see the root and the crown. To be very accurate, I'll be minusing or segmenting the root now from the crown. Here we go. Yep. You can see here that the roots are absent now from the crown. Okay. See, there are no roots exactly right now. Now you can see that the point to be noted, very much important point. While other tooth are having no root, so why this tooth, okay, is having a root here? It's not the root; it's the obturating material which is intact. You can see the three